Hi, I'm Dr. David Baker. I'm Executive Director of Population Health at LifeBridge Health, a large nonprofit health system here in Baltimore. I've taught in Hopkins Masters in Population Health Management program for over 5 years and now serve as a co-director for the program. I'm very happy to have one of our recent alumni join us today to share his experiences. Please introduce yourself, Maarten Van Aken.
Thank you, Dave. Great to see you again, and thank you for having me. So my name is Maarten Van Aken. I'm an internist endocrinologist working in the Netherlands, in The Hague, in a teaching hospital there, the Haga Hospital. And one day a week, I'm working at the Leiden University Medical Center, where I'm advancing population health management now.
Fantastic. And can you explain a little why you started exploring graduate programs in population health at this point in your career?
Sure. Well, as I told you, I'm an internist endocrinologist, treating a lot of patients with chronic diseases like type 2 diabetes, thyroid diseases, etc. And more and more, I noticed that our way of organizing healthcare really falls short because we miss essential elements in our approach. Especially in the hospital setting where I'm working in, we are not connecting very much to primary care and to the social domain, and actually missing a lot of opportunities there. So that made me search for programs that would potentially fill in that gap.
And population management seemed to do that. What attracted you to the program at Johns Hopkins versus other programs?
Well, first of all, of course, the excellent teaching faculty and the reputation of Johns Hopkins is really, of course, top of the world. So I was really thrilled when I read that Johns Hopkins was offering this program fully online, of course, which is also a big advantage for me, like working in clinical practice and being able to combine in such a way this great program. And thirdly, of the curriculum really showed right variety of subjects that all appeal to me, and I was really I was excited when I was learning about this program. So that made me choose to apply for this program.
Excellent. And having gone through the program, what would you tell people who are considering applying to it?
Well, in my experience, if you're working in healthcare, in any issue, in any domain of healthcare, and you are searching for new ways to reorganize healthcare more in aligned way with other partners in the network, you're searching for tools to do so, this program of population health management at Johns Hopkins is really offering all these tools in a very, very exciting way, that engaging way that will help you to bring these theories also into practice. So yeah, I can fully recommend this program without any hesitation.
Are there particular skills or tools you feel you've gained through the master's program?
Yeah, definitely. So first of all, of course, it gives you very good overview of the whole approach of population health management and what it entails, a lot of formats that are applicable in daily practice, especially then specific tools such as risk stratification tools, how to really engage your co-workers, your network, how to bring things into practice and let them work, like with the collective impact approach. And besides that, it also offers like basic skills like epidemiology, statistics in a very engaging manner. So I had the feeling, having finished the program, that really I was provided the necessary tools to start working with PHM in practice.
Are there specific details you could share about how you've applied some of these skills and newly gained capabilities in your work environment?
Yeah, definitely. We are lucky to being able to start a new way of organizing our care for patients with type 2 diabetes, essentially based on the basics of population health management. So we will start with a new certification, actually using the adjusted clinical groups of Johns Hopkins to make a new risk assessment, including all the social determinants of health, and then perform a health needs assessment in these risk tiers, and then reorganize our healthcare, including in the social domain activities that are so important. So yeah, really bringing into practice population health management in all its facets. So yeah, I'm looking forward to do that, and it's exciting.
Excellent. That's excellent. And I think one question a lot of folks who are watching this have are, immediately is the application process. Can you talk a little bit about your experience doing that?
Yeah, sure. Actually, so for me, of course, it was coming from Europe and being unfamiliar with the system in the US. It was quite exciting to start this process of application. But it's really very well organized, because you're assigned a application officer who's really taking care of the whole process, is really helping you to go through all the steps with all the deadlines, and that really helped me a lot to fulfill the application period. Yeah, so it's great.
Fantastic. Well, I really appreciate you sharing your time with us today. And again, thanks so much for sharing your experiences. And to end this, I want to share with folks watching just sort of next steps in the process. So you can find more information about the program on our website here. You'll see the link. If you have specific questions, feel free to contact our admissions officer, Morgan Fredericks. And when you're ready to apply, you can apply either to the sort of the standard 2-year Master's in Applied Science and Population Health Management using the QR code on the left. Or if you're interested in the 1-year certificate program, you can use the QR code on the right for the certificate application. Thanks again, and good luck.